Ladies and gentlemen, our next speaker is Dr. Maureen Storey, who hopefully will now join us. Maureen is the president and the CEO of the Alliance for Potato Research and Education. It's a fairly newly formed initiative in North America, and Maureen's going to talk about the work of that alliance, and she's going to discuss with us the role of the potato in a healthy diet. Maureen, we look forward to your presentation.
Thank you, Tony. I'd like to thank the organizers of the 8th World Potato Congress for inviting me here. I've never been to Scotland before, so it was a real treat yesterday to walk around this beautiful city and enjoy the sunshine. I know we have a very tight schedule, so I'll get right to it and talk to you very briefly about the Center or the Alliance for Potato Research and Education. This is our mission statement, which is 100% dedicated to expanding and translating scientific research into evidence-based policy and education initiatives about all forms of the potato, which, as we all know, is a nutritious vegetable, in promoting the health for all age groups and all countries. This briefly introduces our research framework that was developed by a scientific advisory council as well as our economics advisory council that I'll introduce you to in a little bit. But you can see from our slide that obesity is one of our 4 pillars of research that we will be addressing over the next several years. One of the areas of research, or one of the pillars that our advisory council strongly urged us to undertake, was addressing the myth that potatoes make us fat. If we turn to the World Health Organization, the World Health Organization has noted that we have approximately 1.6 billion adults around the world who are overweight and at least 400 million adults who are obese. This also extends to children, with about 20 million children under the age of 5 being considered overweight globally. And the WHO predicts that by 2015, approximately 2.3 billion adults will be overweight and more than 700 million will be obese. This map of the world shows the overweight among the adult population. The darker the area, the more people are overweight in that particular country. I'm not sure that I'm very proud to say that the United States is one of the most overweight countries in the world, but it is what it is. This map shows the obesity rates around the world as well, and again, we have the dubious distinction of being one of the most obese countries in the world. Now, more troubling than adults being overweight or obese is obesity and overweight among our children. And this map indicates the troubling trend that has taken place over the last couple of decades. In the 1990s, girls around the world, particularly in Mexico and Central America, over 30% of girls in Mexico in the 1990s were considered to be overweight. If you look at the 2000s, girls, that extended into the United States, and more girls were becoming overweight in the 2000s. Now, girls were not the exception to the rule. Boys were also overweight, and in the 1990s, Canada actually led the way with regard to more of their population of boys being overweight than any other country. But by the 2000s, the United States had caught up, and several other countries, including Spain and Italy, had over 30% of their boys considered to be overweight. Now, we know that the consequences of obesity are not trivial. There is an increased risk of cardiovascular disease, including coronary heart disease. There's an increased risk of high blood pressure, type 2 diabetes, which has its own health consequences of glaucoma and amputations later on in life, and many other health problems. What we see now is that, at least in the United States, we have seen consequences of type 2 diabetes occurring in our children. It used to be that type 2 diabetes was known as age-onset diabetes because typically we did not see the consequences of type 2 diabetes until much older ages in life. But now we are seeing the same things in our children, which is very troubling. Which is why First Lady Michelle Obama has focused her attention on obesity, particularly in childhood. And she's focused that with her Let's Move initiative. One part of her Let's Move initiative draws attention to encouraging consumption of more fruits and vegetables in both children and adults. And a few weeks ago, I was very happy to see that she was drawing even more attention to consumption of fruits and vegetables by planting potatoes in the White House garden on the White House lawn. So hopefully, the First Lady and her efforts will have an impact on what we're seeing as a very dangerous trend that has been documented by the U.S. Department of Agriculture and its Economic Research Service. They have examined trends in per capita availability of fruits and vegetables. Per capita availability is not true consumption, but it is a good proxy of consumption of fruits and vegetables. And what the Economic Research Service has documented is that in the last decade, we have seen actually a decline in total fruit and vegetable consumption. The decline in total vegetable consumption has been led primarily by a decline in starchy vegetable consumption. Now, there is a hypothesis that if you just decrease potato consumption, that dark green leafy and dark yellow vegetables will automatically increase. I think that you can see that the decline in the potato consumption in the United States, as measured by per capita availability, has done nothing to help increase the consumption or the availability of dark green leafy vegetables or deep yellow vegetables. So as a scientist, I would say that that hypothesis is not holding true. Now, last year, the situation for potatoes was extraordinarily challenging, led the way by an interim rule put in place by the U.S. Department of Agriculture in 2007 that told women in what is called the Women, Infants, and Children Supplemental Nutrition Program. This is a program administered by USDA for low-income pregnant and lactating women and their children under the age of 5. The USDA told women in this program that they would not be allowed to use their WIC benefits to buy potatoes in a supermarket. They could buy potatoes in a farmer's market, but not in a supermarket. So that was one challenge that we are addressing with the National Potato Council. Then USDA, last January in 2011, proposed a rule that would limit serving of starchy vegetables in the federal school lunch and school breakfast program. And what that regulation proposed to do was to limit the serving of starchy vegetables that would include white potatoes, sweet corn, green peas, and lima beans to 1 cup per week. What that meant is that if you served a baked potato on Monday in schools, you were done the rest of the week. You could not serve any more potatoes, corn, peas, or lima beans for the rest of the week. Now, I started at the Alliance on June 20th, and on June 23rd, a paper was published by a group out of Harvard School of Public Health, was very well publicized, that more than any other food, potatoes make you gain weight over a certain period of time. That was not a welcome sight when 3 days into the job. A month later, McDonald's announced that they were going to decrease the serving size of French fries in their Happy Meals, and the National Restaurant Association announced a new program called Kids Live Well that also provided for very strict nutrient criteria as well as criteria that would eliminate French fries from the children's menus. In September, the Harvard School of Public Health also announced their healthy eating plate, and they encouraged consumers to eat more fruits and vegetables, but in their healthy eating plate, they said that potatoes do not count as a vegetable. And then another restaurant group, along with the First Lady, announced they had a new kids menu as well that would require parents to ask for French fries for their children's meals. So the environment in the United States for potatoes of late has been really quite challenging, including some of the details that we found in that Harvard School of Public Health study, that this chart was publicized throughout the media and clearly shows in this epidemiological study, which does not show cause and effect, but is a very powerful study, that all forms of the potato are responsible for leading to greater weight gain over a period of years. Now, what is interesting, however, is that another government study that was presented for the dietary guidelines for Americans in 2010 showed that the U.S. food supply, as everybody's food supply, is very complicated. And what this graph shows is just how complicated the food supply is, and that fried white potatoes are really a very small percentage of the total calories that are coming from the U.S. food supply. If you look, actually grain-based desserts are the #1 source of calories in our diet. Grain-based desserts mean cookies and cake and brownies and things like that. And if you add up the percentages, actually grain-based desserts plus dairy-based desserts plus candy make up over 11% of our calories. Probably not exactly what a nutritionist would recommend for anybody. But the question that Caroline asked me to address, can potatoes be part of the solution to obesity? This is a very provocative question for any food other than water, because any food has calories in it. So how can you be part of the solution, particularly when obesity is unlike any other condition? It's not an infectious disease that you can cure with an antibiotic. It can't be prevented with a vaccine. You have to rely on people's willpower to eat what they need in the context of the energy that they expend through physical activity. And a lot of people don't find physical activity nearly as attractive as eating cookies or brownies or anything else. But there is some research that is out there on what the potato or certain parts of the potato can provide that may help in controlling appetite or controlling food intake. This was a rat study that was published last year, and rats were fed a compound found in the potato to see what it would do to cholecystokinin levels. Now, cholecystokinin is a peptide that is found in the gastrointestinal tract, and it helps in controlling your appetite. What the animal study showed was that when these rats were fed this potato compound, was that they gained less weight than rats that were not fed the compound, and they had lower food intake than rats that were not fed the compound. Another study in humans looked at potatoes versus rice versus pasta. And what these researchers found was that in feeding equal amounts of potatoes versus rice or pasta, that actually people ate less food when they had been fed potatoes as opposed to rice or pasta. So that's the good news, as well as the lower insulin levels and ghrelin levels, or higher ghrelin levels, which is a good thing because that helps control your appetite in this study. So these studies are all very, very important. However, we need more of these. And that's why the Alliance for Potato Research and Education is really focusing its efforts on creating that science base on the potato and potato products so that we have the data that can make a good argument for why the potato is so important in our diet. The first thing that the Alliance did was begin to build that science base along with the other pillars that support our mission and our goals. First things first, one of the first things that we did was try to understand the nutrient profiles of potatoes and French fried potatoes. A lot of scientists, if it's not their field, really don't know that potatoes are an excellent source of many nutrients, including potassium and dietary fiber. We also felt that we needed to understand the consumption patterns of potatoes and French fried potatoes across all age groups. We hear in the Washington, D.C. area, well, people eat enough potatoes, or they eat too many potatoes. Well, you have to ask the question, well, how many is that? I don't know how many too many is. And so that was another important aspect that the Alliance focused on right from the beginning. This chart clearly shows, and we've been showing this to many audiences around the country and in Canada, that potatoes are probably the best source of potassium in the produce aisle. Doesn't matter if they're deep fried from a quick service restaurant or a fast food chain to a baked potato to oven-baked potato fries that might be served in schools. Potatoes rule as far as potassium is concerned. Why is potassium important? It's good for your heart. It helps blunt the effects of sodium on blood pressure. Next, we knew we needed to develop a long-term research plan. So we convened a scientific advisory council as well as an economics advisory council of subject matter experts from across Canada and the United States to identify and help us develop those pillars of research that I showed you early on. We also started collaborating with the USDA Nutrient Data Laboratory because this laboratory has the nutrient composition of 4,000 foods in the United States. And if their database is out of date, then the research studies that come from that database are also not accurate. So we want to make sure that whatever innovations are taking place amongst our potato processors, that the USDA has those data in a timely manner because it does affect the research. This is our advisory councils. We have a number of folks with varying degrees of experience. Nick Bellissimo from Canada is an assistant professor. His area of expertise is the glycemic index and satiety. To Dr. Joanne Slavin, who is a dietary fiber expert. We've got obesity expert and communications as well as food scientists. And then we have an all-star cast of economists who are looking at a variety of research studies for us. As far as what we call intramural research, the Alliance for Potato Research and Education, I've presented 2 poster presentations at the largest experimental biology meeting probably in the country, if not the world. Presented actually the potato consumption and calories from potatoes last month, potato consumption among adults as well as children and adolescents, and I'll be presenting another paper at another society meeting on vegetable consumption, including potato consumption among women in the WIC program. These data are some of the data that I presented at Experimental Biology last month, and what this shows is that really mean calories from French fried potatoes consumed by male and female children is really a very small portion of the total calories that they are consuming. I will say that the scientists that stopped by the poster were really quite surprised at how few calories are coming from French fried potatoes on average. They read the newspapers just like everybody else, so the actual data was very astonishing to them. We've supported 2 studies. Extramurally, we are looking at a plate waste study at Texas A&M. I'll show you those details in a bit. And we're also supporting a university roundtable at Purdue on white vegetables. They are a forgotten source of nutrients. At Texas A&M, one of our economics advisors, along with a colleague who is a nutritionist, is looking at the economic and nutritional consequences of limiting potatoes and substituting other vegetables in school lunches. We know that children like potatoes. We know that a lot of children may not like broccoli, and it's more expensive. So this study is going to look at what happens when children are fed a meal at school with potatoes versus non-potatoes. We think that what is likely to happen is that the potatoes will be eaten very happily, and a lot of the schools will probably have some quite expensive vegetables in the garbage can. But we will see what that brings. This is the agenda for the Purdue Roundtable that's occurring next month. It's going to have extended reach because we will be publishing the papers that are coming out of that roundtable. Nutrition Today is a journal that is read by registered dietitians, and we also will have extended papers as a proceedings in Advances in Nutrition, and I'll be presenting some of the data that on potato and French fry consumption in that roundtable. We also, in addition to conducting research, are forming partnerships with not only the government, but also other non-governmental organizations. The first partnership that we developed was actually with USDA in helping to promote their new icon, MyPlate. The pyramid is dead. Nobody knew what it meant or how to use it, and so in this last go-around of dietary guidelines, the icon for consumers was MyPlate. And so the Alliance for Potato Research and Education became a national strategic partner with MyPlate to help promote Make Half Your Plate Fruits and Vegetables. And on our plate, potatoes are a vegetable. We also developed a partnership with the American Dietetic Association, now known as the Academy of Nutrition and Dietetics Foundation, and their Kids Eat Right program. We helped supply a grant so that dietitians could go out and talk to parents and teenagers about the importance of the family meal, regardless of where they are at, whether they're at home, at a restaurant, at a quick service restaurant, or even in the car. We like to eat in the car. A lot of people don't, but that's habit in the United States. So that partnership is going very well. The toolkit was launched in March, and we have 50 grants out to registered dietitians who will deliver that toolkit to a variety of audiences. Science education. If you don't educate people about the research that you have, it doesn't do any good. And so this is a key element, a key strategy for the Alliance. We've been to a number of state and national meetings talking about the science, talking about the role of the potatoes in all forms for the health of all people. We have a lot more to go for the fall, but we think that sponsorship of some of these venues is a very important way to get the messages out about potatoes. We also have a print ad that we placed in one of the state dietetic association meetings, urging dietitians to know the facts about consumption of potatoes among school children. There's too many myths and too many hypotheses about what's going on, and so this ad clearly explained in a very factual way what the actual consumption of potatoes among school children is. We plan to have this ad or a similar ad placed in another health professional journal for back to school time, coming this July and August. We have some very talented nutrition communicators who are part of our team. Actually, we have 2 more that we added last week. The other 2 are from Canada, so we have 3 Canadian dietitians who have a variety of skills. These people tweet and they blog and they have Facebook pages. I don't tweet or blog. I don't know how and don't want to know, actually. But these guys know, and they're really good at it. So they are very active in promoting the messages about potatoes, about oven-baked potato fries, potatoes in all forms. The 2 Canadians, we have one Canadian dietitian in Toronto. We just added one also in British Columbia, and then the 3rd one is in Quebec, and she is also French-speaking, so we will be able to translate our materials into French as well as Spanish with Claudia Gonzalez as one of our nutrition communicators. Now, Bethany Thayer is one of our communicators, and what APRE has done is develop 13 videos that we are going to place on our website, which will be launched June 15th. And these videos will be rolled out throughout 2012. We'll be developing other videos for next year as well, but I thought I would share with you 2 of the videos that you'll see on our website in the next coming months.
Hi, my name is Bethany Thayer, a registered dietitian from Michigan, here to share the facts about children's potato consumption at school. According to the latest data from the Centers for Disease Control and Prevention, school-aged children on average consume less than 1% of their daily calories from white potatoes at school, including oven-baked potato fries. And they pack a nutritious punch. These oven-baked potato fries deliver important nutrients like potassium, dietary fiber, vitamin C, vitamin B6, magnesium, and iron. In fact, this serving of oven-baked potato fries provides more than 3 times as much potassium as a half-cup serving of cooked spinach. So whether the potato is baked, boiled, mashed, or fried, this kid favorite contributes important nutrients to their diet.
And our second video is by Lauren Swan, and she's urging people to remember that starchy vegetables are important in helping build your plate.
Hi, I'm Lauren Swan, a registered dietitian from Pennsylvania. Somewhere along the way, starchy vegetables have become vegetables to avoid. Yet these tasty treats provide many nutrients, including those identified by the 2010 Dietary Guidelines Committee as nutrients most Americans, adults, and children aren't getting enough of, also known as nutrients of concern or GAP nutrients. So what is a starchy vegetable? Peas, potatoes, lima beans. These vegetables provide many important nutrients. Somehow, starchy has become synonymous with bad. Don't let the term fool you. These vegetables are important sources of many key nutrients and provide nutrients of concern like dietary fiber and potassium, as well as additional nutrients unique to each vegetable. Potatoes are one of the best and cheapest sources of potassium, not to mention the dietary fiber, the vitamin C, the vitamin B6, and the magnesium and iron they provide. Don't forget starchy vegetables like potatoes when building your plate.
Now, like all of us, APRE is on a tight budget. And those were shot in my kitchen. So we saved a little money in going someplace else. So please look for these videos as well as some of our materials when our website is launched on June 15th. The URL is www.apre.org. I hope that you'll agree that the Alliance has covered a lot of ground in the last 11 months. We're not a year old yet. We've got our goals and strategies put in place. We've got a governance structure, which I didn't show you. We've got a lot of science already in place and building more. We've got a scientific advisory council, an economic advisory council that is second to none. We've got partnerships that are always very important. We're going to be launching our website very, very soon, and we've got some dynamite nutrition communicators who are going to help us spread the good messages about potatoes in all forms to influencers like themselves. So I thank you very much for your time and attention today.